Stop taking video. It's working. Okay, today we're going to be talking about one of the three cores, and it's either assessment, treatment planning, or counseling. I did my video on the tools of assessment, which were the mass and the audit test. And today I'm going to be talking about two of the treatment plans that we do at Intervention. And I'm going to be using my director, Nicole, again, as my wonderful person. And we are using her as a client who has two DUIs. She's on probation. She failed a drug test for alcohol and THC. So her probation officer told her she had to have an assessment with anyone she chose. She chose us. And Brandy did an assessment. And she did the mass and the audit, which for y'all who do not remember, the mass is a Michigan alcohol screening test, which is a simple self-scoring test that helps assess if you have a drinking problem. And then the audit is the alcohol use disorders identification test. And then, of course, then Brandy did her alcohol and drug evaluation. She has a history of drinking since she was 14, just to give you a little bit of her background. And she got her first DUI about 7 years ago. And then this DUI right here about a year ago, and it had an accident with it. And she hasn't been doing anything that she's supposed to be doing for her probation. So here she is. So after the evaluation, Brandy decided after treatment teams that she needed about 18 to 26 weeks of treatment. And the two treatment plans that she's going to be under is the first one is lack of knowledge of chemical dependency. And what that will involve is problem one is evidenced by she denies that she's chemically dependent and has a problem despite direct feedback that the use of alcohol and or drugs is negatively affecting herself or others. In other words, she doesn't see the fact that the drug test, she's on probation, she shouldn't be drinking, is causing her work problems, she doesn't have a job anymore, those kind of things. Inability to control use or stop drinking alcohol and or using drugs even though she knows it exacerbates these problems. And impairment in social, occupational, psychological, or physical functioning as a result of chemical abuse and dependency. The short-term goals of these when the date initiated will be the day that she signs the contract and when she starts her groups, and then it'll be 4 months from this will be her treatment if she does well. She will attend a minimum of one outpatient session, consists of 3 hours, which will be one of our groups, which include a lecture and process group each week. She will complete assigned material in order to increase knowledge of addiction and the process of recovery. She will submit and observe random urine drug tests and monitor her abstinence from alcohol and chemical use. She will attend lectures of the disease of addiction, tools for recovery, and relapse prevention. And she will identify the consequences related to continued use. You got all that? I should be looking at you and not this, I guess. And you will verbalize a personal understanding of and acceptance of the disease of addiction.
Yes.
And then interventions, our discipline, we will do this. A counselor will be facilitating your group and provide education on the topics of the disease of addiction, tools for recovery, and relapse prevention each week. A counselor will also require you to attend one outpatient session weekly and to monitor your program attendance and participation. Counselor will also require you to attend a minimum of 6 outside 12-step meetings, either at Celebrate Recovery, NA, or AA, whichever one fits you best. And a counselor will also provide you with educational resources related to your chemical. And in your case, it will be alcohol and marijuana. Okay, and then the other treatment plan is lack social support and network to maintain abstinence.
Right.
And in her case, obviously, you're not able to maintain that for very long periods of time.
Right.
And you've had this is the problem. She social network of friends drink and or use.
Yeah.
Is that true? Family members don't understand your addiction or illness.
Right.
And you have minimum support in helping you to maintain your abstinence. And that is what intervention is here to help you get and find. Okay. Okay, short-term goal will be that you'll be educated in the the necessity of recovery support group, and will share barriers if you don't, goodness, and will share barriers if they don't attend. You need to attend each of your groups so you can get the full group process.
Okay.
Disclose and process groups about family or friends that drink and use, and share your feelings about all of that.
Okay.
Be honest and share desires and or cravings to drink and use with process in the group.
Okay.
Practice relationship skills through participation in groups, and look for and secure temporary sponsors, and have at least 5 friends in recovery.
Okay.
During this time that you're in here.
Okay.
Alrighty. And the counselor will do the same as she did, or I do, or Brandy does, in your as with the other treatment plan. And you do all that.
All right.
There you go. And Dr. Grimm, that is all I have for this today. Thank you. All right. The end. And that's going to be enough.
All right.
I think that did went all right.
That was good.
Well, 7
He'll
minutes.
give you 100. It'll be fine.
I think so too. Let me just save it. It's still going.